Hi, my name is Professor Morris. Welcome to our YouTube channel. Today we're going to be taking a look at the role play from the OET medicine. Now this first sample, what we have to be careful when we are studying or preparing for the OET is the background, like who are we talking to and why are we talking to this person. So in this case, the card says you're talking to a 57-year-old daughter or son of a 93-year-old patient, the mother, who has recently sustained a stroke. The patient has been discharged at home, and the daughter is concerned about the condition and further treatment of her mother. Now, it doesn't tell you any information about the name of the daughter or the son, so this is important. You have two ways to do it. You can, during the 3-minute preparation that you have, you can ask the interlocutor, "How may I address you during the role play?" This way you can know the name of the person that you're going to be talking to and if it is the daughter or the son. The other way that you can do it is you can ask the person's name in the beginning of the conversation. Now this is totally up to you, okay? So let's imagine that you decide to ask the interlocutor during the 3-minute preparation, "How may I address you during the role play?" So when you start the role play, you already have this information. For example, let's imagine that the daughter's name is Jennifer. So you could start the conversation in a variety of ways, but this is a possibility. "Hi Jennifer, my name is Dr. Martin. Welcome to the Community Health Center. I can see that you're here on behalf of your mother, is that right?" And then you develop the conversation, develop the role play with that. Now let's imagine a second scenario when you decide to ask the name of the daughter or son during the conversation. So you would start a little bit differently. You would say, "Hello, my name is Dr. Martin. Welcome to the Community Health Center. May I confirm your name, please?" Then she would say, "You can call me Jennifer." So Jennifer, welcome. So tell me, how are you related to the patient? Then she will say that she's the daughter, okay? And then you can ask, for example, "Yes, I remember. I have treated your mother. So what can I do for you today?" Then she will tell the reason why she's there. Now remember that this is the doctor card, okay? So the interlocutor will have a card that is a little bit different. So he will have some other information that you don't have in this card, but you have to follow the 4 tasks that you have here. So the first thing that you have to do is to reassure the daughter of the support of the community and health center. Then the second task is explain to the daughter what a stroke is and how it affects the patient. Now remember that you're talking to the daughter, you're not talking to another doctor. So when you explain stroke here in task number 2, it has to be something short and clear. For example, a stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen. Is it clear, Jennifer? So whenever you give an explanation, for example, it's interesting to check to see if the patient understood what you said. Now you need to make a transition from task number 2 to task number 3. You can do it in different ways, but one of the possibilities is saying, for example, "Okay, now that I have explained what a stroke is, let me tell you about the further care of your mom at home." And then you go over task number 3. When you finish task number 3, for example, we can ask, "Do you have any other questions?" And then probably the daughter or the son will ask you something. Now this is important. Sometimes they might ask you something that you don't have in your card, and that's totally fine. What you should do in this case, you should answer the question briefly to the best of your knowledge and then move to the next task. In this case, task number 4 is the last one, so advise the daughter what signs can be suggestive of another stroke: difficulty speaking, vision problems, loss of balance, weakness in the face, and so on. When you finish the task again, you can ask a question: "Is it clear?" and then depending on her answer, you might have to answer some more questions she might have. And then imagine that you finish this role play too fast, for example, and the interlocutor doesn't say anything. It means that you still have some time to cover. So what you could do in this case is to summarize what you have talked to the daughter today, for example. So let me just recap what we have talked about today. Then you go over task number 2, task number 3, task number 4. When the 5 minutes are over, the interlocutor is going to stop you. She or he will get the card from you and give you another card, and then you're going to start the 3-minute preparation again for the second speaking role play. Okay, so if you have liked this video, make sure to like and subscribe. Also leave a comment below to see if you have any questions about the OET speaking role plays. Have a great day, and I will see you next time.